So in the sumo deadlift, people get this pain kind of like in the front of the hip. Sometimes it's more in the abipu area, or like a little bit lower in the essentially where the psoas inserts. Um, so what that tends to be is overactive. Let's a couple things: overactive psoas slash hip flexors, an untucked butt, meaning you're in lordosis or you're in like lumbar extension excessively, and another reason, the third reason I see a lot, and this is my problem personally, besides the hip flexor issue, is not bracing real low. So the sensation, this is important for the sensorial aspect, the sensation should be in, like, if this is my hip and my groin is right about here, right? I want to be bracing into this here, right into my balls. I want to brace, not in my chest, not even up here, but fill the lower half as much as possible and brace there. Picture your obliques going out. Picture your lumbar and your QLs going out back. It's like we call it 3D expansion. It was like an old term back in the day. So when we don't brace very hard or very big, like a huge breath, not just like, but like fill it out and just goes like that. The pregnant belly, sometimes we call it. What happens is it drives this sympathetic chain, not sympathetic chain, it's an actual structure, sympathetic drive, where it causes pain because you are not able to fire your posterior chain in accordance with your hip flexors and your stabilizers and all that, especially since you're essentially being asked in the sumo deadlift to pull without any real level of eccentric loading, like a squat. You're loaded and then you go down. That's the eccentric part, and you explode up. Where you can kind of feel the weight at every position, almost, and then use your body as a rubber band through that tension. But with the deadlift, especially the sumo deadlift, is you're being asked to pull the bar off the ground, lock it out without any eccentric loading, which means it's very neurologically driven. It's very much how fast can we recruit stuff. Sorry, my dog's watching the TV. It's weird. And the problem with that is that we're being asked to do it from this position. Even if we do the hip load and we go in, we're still asking our hip flexors to contract while lengthening, which is an eccentric motion, and that can cause a lot of pain, specifically in insertion areas. So the three things we're going to work on, sorry for the long explanation in the beginning, the three things we're going to work on is, first and foremost, the bracing, and then the hip flexor tightness, and then most importantly, the tucking of the butt. It tends to get a lot of things in order. The problem is that then can change mechanics a little bit, because it puts your glutes at a better position to fire, but not to lock out because you're extended, but you don't need to know the mechanics for that. So first things first is the, what did we say? Let's do hip flexors first. So obviously, your general couch stretch, like I said, everybody knows now, tuck your butt, go forward. You're not trying to hyperextend. So what you can do is you can go into your couch stretch, and then you can turn towards, bend away, brace down into the oblique, into that low area. This is a good way to train the bracing pattern as well. You go down and out, and you can also push yourself there. It's going to help get some rotation in a little bit of rotation in your lumbar, some in your SI, mostly through your T-spine, which is also important to have. So that's your general stretch, 2 minutes. You can also put a ball in the psoas area. It gets kind of hairy. I wouldn't recommend it unless you really know what you're doing. The second thing is going to be the bracing pattern. Sometimes what I have people do is kneel, sit back, tuck the hips, put their hands on their obliques and their thumbs on where the QL is, and just kind of press in for some sensation. Again, tuck the butt, big ass breath, not, but like, watch my hands, you'll actually see them expand. And it almost looks like everything's sinking down and out, like a mushroom almost. That's the kind of bracing that's gonna help that sympathetic drive. It's gonna knock down some of the pain, even though we're not like physiologically changing anything. And then the third thing is we did hip flexor stretch. We did the bracing pattern, which is super important. And then another one, which is for you specifically, is going to be the tucked butt. So you, like a lot of girls are in hyperextension. A lot of people are in hyperextension, and that's not necessarily a bad thing until it becomes a bad thing. It's not an issue unless it becomes an issue, right? It's one of those. So when we're in hyperextension, we now just put our psoas on slack, and if we're in the sumo position, right, you're almost, the muscle is as short as it can, and it's being asked to be a stabilizer in its shortest position, and then you're asking it to extend while being a stabilizer, elongate while keeping its position. And then people end up here, right? They lock out with like their low backs here, and in real deadlift it should be, boom, this is a locked out deadlift. You don't have to be here, right? It's here. See how the difference is essentially a tucked pelvis? So, actually, if you go back onto my Instagram, you'll find that I take a good second or two to like find my hip stability and tuck my hips perfectly. So I'm like, I literally, yeah, this is probably okay. So I literally get into my position. You see me chill down here, right? I'm loading my quads, I'm loading my glutes, I'm finding the stability and contraction where I need to be, and then you'll also see me do this, where I bring my knees and my hips forward, but it's not actually bringing them forward. I'm not just doing this, right? I'm actually tucking my butt, extending through here, and then once I feel everything catch perfectly, again, tucked butt, that's when I go down, load, still tucked, not extending and not over like arching or anything, rounding. It's down with the tucked ass, and then knees forward, kind of out, pushing through the floor, the general thing. So super important is going to be the tucking the butt. One of the things you can do for that is while you're warming up, get 135 on the bar. Get 135 on the bar, practice your positioning, get where you need to be, tuck the butt, tuck the butt, tuck the butt, keep that bad boy squeezed. Grab the bar and then hyperextend into a position that you don't want to be in. And then tuck your butt. Extend, tuck your butt. And then you can do that for a couple reps, take a rest, do it for one more set, but with a brace. So it's gonna be like, tuck the butt, extend, tuck the butt, extend, and then brace. And you're gonna, while you're bracing, doing the flexion extension of the hips, you're going to feel the two differences in the position. Because if you're bracing very hard like we did before, that's why we wanted to address the bracing part first, is you get the right sensation, then you go into extension, you're like, oh, something's pulling, this is very uncomfortable. I can't seem to like contract my glutes or my hams or anything very well. And then you bring it into more of a tucked butt position. Your abs are like, oh shit, I am very stable. Like, this feels like a balloon pressing out. And then your hips are also like, oh, this is not painful. And then your ass is like, oh shit, I'm tight and strong and I can basically propel the deadlift, because that's essentially what does that, is the glutes in the back. Obviously knee extension is super important, but everybody says, oh, knee extension is the most important. You're like, well, you can't lock out a deadlift with just knee extension. You can knock out a deadlift with just hip extension. That's neither here or there. Do those three things. Stretch on a regular basis, do your core work, and practice bracing, and then tucking the butt.